everyone, my name is Chasity Orr. I'm the Stroke and Telemedicine Coordinator here at Great Plains Health. I have been with Great Plains Health for almost 11 years. I was asked to speak with you today on why I am a high performer. I was told a month or so ago that I was identified as a high performer, which was interesting for me to take. I see myself more as a solid performer, so I want to thank you for believing in me and telling me that I was a high performer. What I want to talk to you today about is why I do what I do, because even though you have identified me as a high performer, I feel like I'm just doing what I need to do to make a difference in people's lives. Every day when I get up, I tell myself, okay, what am I going to do today to change someone's life? Even if it's a coworker, a patient, someone just in the community, that is my goal every day, is to make a difference in another person's life. I spoke with a few people that believe that I am a high performer to ask them, what do they see? One of the things that was talked to me about by a few people is how I own what I am doing. For the stroke program as well as the telemedicine program, those programs, I own them. Anything that goes wrong with my programs, or if there's something that's identified that needs to be improved, I own that, and I figure out how do we make it better, how do we improve. One of the things I wanted to talk about is a project, to kind of show what I mean by owning my own project and owning my own services. For stroke, when I got into this role, we wanted to do a stroke screening, and that was to help identify and to teach the community people that are at risk for a stroke, because most of us are walking around out there and have 1 to 2 risk factors that can't be changed, the fact that we're women, our age, our race. And so we wanted to get the identifiable risks out there, screen people for them. And it was something that I was very passionate about, but so was so many people on my team. And so I worked with everybody. It took us several years. We had several obstacles to go through. We had to make sure that we were meeting all the needs of the community, being able to have the staff we needed there, whether it was educational staff or occupational speech and physical therapy, really getting EMS on board and helping us with EKGs and vital signs and helping teach patients, getting diagnostic imaging on board to do those carotid screenings, having Dr. Kumar, and this year we had Mary Lou as nurse practitioner. And so I was involved in every step of that. And one of the things I think for a high performer in my type of role is to realize, which is hard, to realize that you can't do everything, and you have to trust the people around you, and you have to help push the people around you and be a part of that. But you also have to be there for them and help them in every step that they might need that help. For instance, moving forward, I work with Jenny Peterson in DI. We had several obstacles that we have met with doing the carotid screenings at the stroke screening, and her and I worked together and we met those obstacles together and we pushed forward, because we're pushing forward not just to make this happen, because having the event doesn't mean anything if you don't have those people there, the community there, to assess them. And so what we were doing is we were pushing it for the people in our community. For me, when I'm pushing like that to make something happen, I'm not pushing because I want to be noticed, or I want to be that person in the background that's just doing the pushing. And so that's why I really support my team. But I want to make that difference in the community. With that being said, like when I want to be that background person, I want to be the person that makes others succeed. So when I see nurses that are new to the hospital, when we do our Monday Skills Lab Day, I really emphasize the fact that I am there for them. I'm teaching them about the stroke program, and I'm teaching them about the telemedicine program. But when they're in the mix of it, it's always different. And so I want to be there for them. I tell them, you can call me if it's urgent, emergent, even if it's 2 a.m. And I've had those calls at 2 a.m. because in order for our patients to get the care that they need, our nurses need to succeed. And so as I guess what people would see as a high performer is being available to make others succeed, not just to succeed myself. Because it's all about the patient. It's about being there for the patient. It's about making sure that they not only get the care that they need physically, but getting that emotional care that they need. For instance, like I said, I've gotten a call at 2 in the morning to help clarify some difficulties a nurse was having with a patient. I have sat with a family for 5 hours working through the life change that they're having, helping connect them with case management on what their needs might be, helping them work with physical therapy, because it's about, that's what I focus on every day, the patients, the needs of others, because it's important to make that happen. When that happens, then that's when everything feels perfect and feels right. One of the reasons that I'm at Great Plains Health, initially when I started at Great Plains Health, it was the excitement. I was newly married. My husband was from here, and I was excited to work at a local hospital. And along the way, you just realize what a family there is here. I've worked in the operating room, I've worked in the emergency department, and now with stroke. With stroke, I ended up in the nursing administration department, I ended up in education department, I've ended up in, and I have now stayed in the quality department. And each one of those levels, it was like mini families within a big family. You really get to know the people that you're working with. You get to experience their life because you talk to them, you care about them. And so that's one of the things I love about Great Plains Health and working here, and it helps me succeed because when there's that caring for others, when there's that connection with another person that you're working with, it helps you want to push it more. It helps you want to succeed more for them, to work with them, and make that difference. Excited to continue to work here at Great Plains Health and to continue to move forward and to help and push my programs and help the people around me succeed, so that way we can make a difference in each other's lives, make a difference in the patient's life, and make a difference in the community. I again thank everyone that believed in me, everyone that feels that I'm doing so well. I can't thank you all enough for helping me become who I am today. Thank you.